Hi, my name is Dr. Lexie Wang, and I'm a facial plastic surgeon at West End Plastic Surgery in Washington, D.C. On today's episode of Face the Facts, we got suggestions from the audience members about what to talk about, and the question that we got was, when do you ditch filler and go to fat grafting? So I'm going to just caveat this by saying these are actually completely different, even though they function the same way. So you can do fat grafting and filler at the same time. You can do one first, you can do one after. They are different, they function differently, and it's really not a matter of like, oh, you age and then suddenly we have to switch over to this one. They still do the same thing in concept, which is that they both add volume back to the face. So both filler and fat do that, but it's just a matter of how you want to go about doing that is how we decide which one to do. Some people who are very, very young will come in and say, I don't even want to mess with filler, let's just go ahead and do fat. Other people for the rest of their lives will only ever stick with filler, and that's fine. Explaining them a little bit further in detail and why you might want to do one versus the other. So first of all is, the longevity of how long they hang around. So traditional fillers, like stuff that you hear about on the market, Juvéderm, Restylane, those types of things, a lot of the hyaluronic acid fillers are not necessarily permanent. Of course, we are starting to find that they do last a little bit longer than perhaps advertised, but they are not necessarily permanent. There are a couple of permanent fillers on the market, but I at least don't really use them. Compared to that, fat grafting is, for the most part, pretty permanent unless you are to undergo some weight loss or weight changes and things like that. So that's already one difference between the two. The next difference, which I think is one of the most important differences, is that filler is a lot more predictable in terms of how much volume you get compared to fat grafting. So filler, I can pick up a syringe off the shelf and I know I'm injecting exactly 1 milliliter of filler into your face, and there's 1 milliliter of filler in your face, and that's where it's going. Compare that to fat grafting, we are relying on your fat or alive fat cells. These are actually alive cells that, just like the rest of us, need oxygen and nutrition and all that stuff to survive. So sometimes in that transfer process, not all the fat survives and makes it. And so there is some degree of variability of how much of that fat actually ends up staying around. So I might inject, for example, 10 milliliters of fat or 10 syringes equivalent into your face, and maybe only 5 of them actually make it, or maybe only 6, or maybe only 2, and I have no idea which one you're going to be beforehand. So that's the part where it is a little bit unpredictable, and you do have to be aware of that with fat grafting. The next thing is that obviously, when are the results gonna show up? So filler, of course, you can leave the office right away. You're gonna have results right away in the chair, right as we are injecting. Compare that to fat grafting. Again, to some degree, you will see some of the changes right away, but because there's also some fluid that comes with the fat, there's definitely going to be some extra swelling in the beginning. And then again, there's a little bit of a guessing period of how much of that fat actually survives. So we don't know exactly how much of the volume you are going to retain. So again, a little bit less predictability. Finally, a little bit about the color. So hyaluronic acid fillers especially are they're a gel, they're a clear, watery type of gel. So when they are injected into the body, they almost look a little bit very light bluish tinge compared to fat, which you can imagine is a little bit light yellowishy tinge. And the reason I bring this up is that oftentimes when you're injecting really, really deep, like on bone, you're not gonna really notice this, but if you are injecting into areas where it might be a little bit more visible, such as around the under eyes, sometimes you can actually see that showing through. You can see the sheen of whatever you injected. So if your under eyes are looking a little bit blue, it's probably because there's filler there, or if they're looking a little bit yellow, it might be because there was some fat there. So that's what I mean by the different colors, is that sometimes you can actually see that through. Finally, the last thing to know is, and I think this is kind of pretty obvious, is filler, again, you can buy however many stacks of filler that you want and get all that grafted into you. Fat does rely on actually having a source of fat, so you do need to be able to have a source of fat for us to actually physically use to graft. And I definitely do get a couple of patients who are very, very, very petite, and sometimes it's just fat grafting is not going to be a possibility for them because I don't have fat to borrow from them. So that's the last thing I would say is the main difference between the two. So hope you learned something today about when to use fat versus when to use filler. Again, I don't think it's necessarily a temporal thing or a time-related thing. It's more of what are your goals, what are you looking for, and what works for your body in terms of figuring out which one you want to do. So that's it for today's episode of Face the Facts. I will see you guys next week.